We have, these medications, which is, they're mercenary priced, are going to hit you for $1 million. And so we were able to evacuate that risk from your plan through another strategy and say, okay, underwriter, come back and look at this now without these people. That's the power of having the data. It's a data-driven business, and it's hard to get data, let alone getting,
You can't. Face it. If you're with a fully insured group, you're not going to be able to get data. We tried to do it for 5 years, and we would get it. It was some scant, whatever, garbage. But the data we get now, being a self-insured entity versus what we got with fully insured, is night and day. Mm-hmm. And to your point, we can do things about it. We can go,
you can plan. You can take action.
Let's get stand-up desks for people because we got all this back pain for all these people that sit all day long. We can do things like that because it's based on the data, and then have a before and after. Yeah. And that's been phenomenal for us as we move forward. Well, that's to save dollars. Try to save dollars.
Well, where else in your line of work where you pay a big premium for something and then it increases every year and you get no data to support?
Correct.
Nothing, probably.
No.
You go and find a new vendor that maybe has higher quality or lower costs or whatever.
There's no industry like the insurance industry. There really isn't, other than some things that I won't say. Recorded on air. But there really is not, and it's unfortunate because everybody started out in the right place in the right frame of mind. But as things have transpired due to good old capitalism, it's moved in a direction that is unsustainable.
So what were some of the things that maybe you saw when you were with said fully insured carrier, not only purchasing insurance from them, but also negotiating with them as far as reimbursements go? I mean, how did that go?
So from a provider standpoint or from an employer? From a provider standpoint, employer standpoint.
Obviously, you sit in a seat that's much more powerful than, a manufacturer that doesn't provide healthcare in the community.
You do have, and it's the lens is great because you do get to see both sides of those things. Because you do go, wait a minute, premiums increased 12% this year and our reimbursement went up 2%. Yeah. How's that work? Right? And the answer was typically BS, administration. It's an administrative bloat is what it is. I mean, that's what you get down to. And again, it's not throwing darts at these folks, because I'm sure they had great intentions when they started. But if you look at kind of cut to the chase, the people taking the most risk in the system are whom?
Doctors.
It's a guy holding a scalpel or making the diagnosis or whatever. They're the most. Who has the least effect of how much they get paid on? Doctors. It's this guy over here takes no risk, but has this great program in place that wants to keep that in place. So what we saw when we were on the fully insured side of things was not much in terms of flexibility with the program. Not really any proactive. It was all reactive. We couldn't get proactive and say, here's our data, we need to do this, this, and this. It was all reactive to, oh, crap, we need to figure out how to drop dollars down. On the provider side, you need a lot more, and we've done this. We've gone out and hired third parties to pull data, so when we go have those conversations with different providers, different insurers, we can show where our cost of care is compared to what you're paying us to try to negotiate. Now, that's where that balance is, and that's really hard, and that's a whole nother podcast of how much does it cost to go to the provider, how much the insurance company has to pay, and where's the premium go in the middle. But are there providers that are charging and overcharging and doing that? Sure, there are. Is it us? No. But there's certainly ones out there. But gosh, it's just so unique that any of the large cities in the United States, if you go downtown, one of the 3 largest buildings in downtown of any city is an insurance company.